Hello my friends, if you're new here, welcome. My name is Rachel and I'm sharing my journey to healing from years of severe chronic illness, and now I am thriving, doing really well, and I am pregnant with our first child. And so this video today is just going to be a Q&A. I posted a questionnaire on Instagram and you guys asked a lot of really good questions about pregnancy, so I'm just going to use my phone here to look at the questions, and I will also have them timestamped down below, so if there are specific questions or topics you want to skip towards, then feel free to do that. But before I get into it, overall my pregnancy is going really well. I'm 28 weeks now, so I just started my third trimester, and honestly overall everything has been going great and I feel really good. But with pregnancy comes a lot of changes, and so I'll talk about my experience in first trimester, second trimester, and just things that have helped me to continue feeling my best. I'll just go ahead and jump into it. So the first question is, do you plan to have a home birth? And the answer is no. We're actually planning to give birth at a birth center, which is kind of an in-between, like a home-like environment with midwives and really close to the hospital. I actually would love to do a home birth, and that would really be my preference, but when I was 9 or 10 weeks pregnant, I called all the home birth midwives in the area. They were all booked up for my due dates, and so we just decided to go with the birth center and thought that would be a great option because home birth wasn't really an option unless we decided to do free birth, which I wasn't quite ready for, even though I actually do love the idea of that. The next question is, what is your birth plan? Honestly, I don't have a specific birth plan completely laid out yet. I'm looking at getting a doula, and so I'm sure we'll go over that together. But just in general, my approach to birth right now is to trust that my body was designed to do this and to be excited for birth. I'm not fearful. I'm not nervous. I think that could change as I get closer to birth. I'm trying to focus on positive birth stories and to just prepare my body with strengthening exercises, stretches, proper nutrition, and also just protect my nervous system. Obviously, I don't have experience with birth yet, but from what I've heard, the most important thing is to feel safe and to let go of fear and to step into trust that your body is capable and ready to do what it's designed to do. I think it's going to be a challenge, but in such a good way, and I don't know if going through all I have with my chronic illnesses makes me a little bit less nervous. I've gone through a lot of challenging things physically, but this is going to be something that ends in something very positive and is very exciting. And so I think that hopefully all I've been doing these past few years will help me prepare for a better birth. Do you know the gender, or are you waiting till birth to find out? We do know the gender. It's a girl. We did a blood test when I was about 14 weeks and did a little reveal with my family, and that was fun. I do love the idea of waiting to find out, so maybe we'll do that with future kids, but I'm excited to know that she's a girl. Okay, next question. Are you nervous? I guess I just addressed that a little bit, but no, I'm actually not nervous right now. I'm really excited. I'm sure that could change, but for now, I just feel excited. Okay, these next few questions are mostly going to be about diet. So somebody asked, are you still doing the same diet while pregnant? And the answer is mostly yes. I haven't changed a lot. The way that I ate before I was pregnant is very similar to how I'm eating now. I'd say the only thing that has changed has been I've eaten a little bit more chicken and pork than beef. I'm typically like a beef at almost every meal type of girl, but especially in the first trimester, some other types of meats sounded better, and so I just kind of went with that and have just been trying to eat what sounds good and what makes me feel good. And so I still have red meat every day, but I probably don't have quite as much of it as I did before. Another question that I have gotten is, did I have morning sickness in the first trimester? And the answer is no, I didn't have morning sickness, but I did have mild nausea. I never once threw up except for when I got the stomach flu in my second trimester. And I just overall had a lower appetite. I did lose a little bit of weight in the first trimester because I struggled to eat as much as I had been prior to, but I have since gotten over that, and I no longer am dealing with nausea at all. And I say it wasn't morning sickness because it was just like a mild low-grade nausea all day, all the time, and nothing really sounded good. I'm editing this video right now, and I just wanted to make it clear that I definitely felt a lot of changes during my first trimester, even though I continued to feel well. There were things that I did to adapt and adjust so that I could continue feeling my best, and I also prioritized more rest during certain points in my first trimester where that's just what it felt like my body needed. And so I think it's important to remember that pregnancy is hard work for your body, and it's okay to rest and it's okay to slow down if that's what your body is telling you that you need. I actually have a blog post going into detail about my experience with my first trimester, kind of week by week, what symptoms I had and what I did to continue to feel my best. And obviously overall I continued to feel good, but I felt different, and that's okay. That's what's to be expected with pregnancy. So anyway, I'll get back to the video now, but just wanted to make that clear. Any tips for getting in animal foods during the first trimester if you have aversions? So honestly, I would say if you can do dairy, that can be really helpful. Just experimenting with different cuts and different types of cooking, things that might be a little bit easier to eat. Like if you make beef chips, those are kind of nice and crunchy and easy to eat. Those could be helpful in the first trimester, or eating things like crispy chicken skins, or making carnivore chicken nuggets, or if bacon sounds better than beef, like just whatever you can do to get in as much animal protein and fat as you can, do it. Do you take a prenatal or just whole food supplements? I have not been taking a prenatal, but there have been some supplements that I have been taking. I'm going to make a video specifically on this, but basically what I'm taking are minerals like magnesium and other trace minerals, and some whole food supplements like mixed organ blend, as well as desiccated oysters or whole food vitamin C. I'm not necessarily taking the full dose of each one of those every day. During the first trimester, I had a lot of congestion related to pregnancy. I got a histamine and immune supplements from Heart and Soil that really helped with being able to breathe better at night. I kept it pretty simple with the supplements. I just didn't feel comfortable with the synthetic prenatal. I know there are some that are better than others. If I were to go for one, I would have gone for one with methylated folate, but I did monitor my folates before and in the beginning of pregnancy, and it continued to look really good, so I didn't feel the need to supplement, and just tried my best to eat lots of pasture-raised eggs and things like chicken liver around once a week, and that really kept my folate level up well. And so, of course, I'm always trying to get as much as I can from food, but sometimes supplements can be helpful to fill in the gaps. So that's that. Somebody else asked, is carnivore healthy during pregnancy to get all the nutrients baby needs? Well, I'm not doing a carnivore diet. I'm doing more of an animal-based diet, so I have lots of meat, eggs, dairy, and then I have some fruit. I have honey. I also sometimes have organic grains, as long as I'm making sure to have plenty of animal-based protein with them to keep my blood sugar in check. But there are a lot of people that have done carnivore in pregnancy and have had very healthy babies. So I think that carnivore is much better than a standard American diet, what most people are doing. It's much more nutrient dense than that, so I wouldn't be too worried in that regard. Is it the absolute optimal for pregnancy? That I'm not sure of. For me, it's been better to have some carbs with a heavily meat-based diet. Okay, next question. How have your food cravings been? Any wild ones so far? I honestly haven't had any strong cravings, nothing like, oh, I need to have that right now. But there have been some things that have sounded good that haven't sounded good in years. And the ones that I can think of right now are Indian food, because most Indian restaurants use a lot of seed oils. I found a good tikka masala recipe and we made that. And then fried Chick-fil-A nuggets sounded good, which those haven't sounded good in a long time. I don't even know how I remember what they taste like because I haven't had them in 15 years. I was diagnosed with celiac when I was a teenager, and so I haven't had Chick-fil-A nuggets in so long, and I did not get them. And also a peppermint Chick-fil-A milkshake at Christmas time sounded really good, but we just made homemade mint chocolate chip ice cream with much better ingredients at home, and that did the trick. So it hasn't been too intense with the cravings. Curious if that will change at all in the 3rd trimester, but I feel like I've been pretty chill with my food in general. Next question. How did you learn to trust your body with pregnancy after your health journey? Honestly, I have spent years learning to trust my body, and that's been such a big part of my healing journey, is learning to feel safe in my body and to trust that my body was designed to heal. And so I've spent so many years doing that and shifting my mindset and my beliefs surrounding chronic illness that I didn't feel like anything really needed to change in pregnancy, and I was already in a spot where I knew my body could do this and was ready to step into that trust and let go of any fears that I may have had in the past. Someone else asked, have any of your illnesses flared? No, none of them. And I think that's a testament to how much my body really has healed. Okay, next question. Any increase in joint laxity from pregnancy, hormones, or relaxin? Honestly, no. Weirdly enough, my neck, because of the surgery that I've had on my neck, has in general a lot of tension. But during pregnancy, my neck has actually felt less tense, but not in a bad way, in a good way. And my other joints feel good. I'm still climbing, I'm doing Pilates, walking every day, no joint pain. I feel good, which is just crazy considering where I used to be with chronic illness. Are you nervous about raw milk? No, I am not, especially because I know the farm that I source it from. I feel good about it and their practices, and in general, you are more likely to get sick from eating a salad or produce than from drinking raw milk. So it is actually a very low risk food. Are you craving sweets more in pregnancy? I wouldn't say significantly more. I think I've been more of a salty girl, but I've been a salty girl for years now. I might be having a little bit more carbs, but still not very much. Are you scared of giving birth because of CCI? So for those of you who don't know, CCI stands for craniocervical instability. It's a condition that I dealt with in the past. This person says, I'm scared that my CCI would get worse if I was pregnant. No, I am not scared of giving birth because of my past history of spinal instability. I don't have that anymore. My spine is strong, it's stable, and my neck is stable now. And I don't have fear over that. And I think it kind of relates back to that other question of like, are you afraid of pregnancy and birth given your past history? And no, because I'm not sick anymore. I am healthy. I have no reason to be afraid. And I truly do feel that way. I have EDS and it weighs heavily on my mind when considering having kids. Any advice? I did a whole video on this on my other channel, Healing with Rachel. I will link it down below. And it's just my thoughts on, am I nervous about having kids after going through what I went through with chronic illness? And the answer for that is also no. I actually feel that my kids have a better chance of being healthy now that I have healed myself, and now that I know what I know about nutrition and caring for our bodies. I know that there's no guarantees with anyone, but I do believe that my kids have a better chance of being healthy than they did if I had never gotten sick in the first place. Did you have any trouble getting in with a midwife given your past medical history? This is a good question, and I think I really lucked out in this regard. I met with the midwife at my birth center and over my past medical history, and I emphasized this is my past. I don't meet the diagnostic criteria for any of these conditions anymore. I consider myself healthy, and they said, great, and they just didn't ask any more questions. They haven't asked any more questions. I am not considered high risk, and I really appreciated that they trusted me on that, and that they also saw that I am now healthy. And so I know that this could be something that other people could encounter difficulties with, even if you had a past diagnosis that you no longer have. They may not want to take you on, but I didn't personally have that issue, gratefully. What do you feel is the most important preparation step for getting pregnant? I'll just answer from me specifically, and I think that was just making sure my body was nutritionally in a really good place. That involved years before getting pregnant of eating an animal-based diet, and that helped me actually get my cycle back. So for years when I was really sick, I basically lost my cycle. I was able to get that back after I started an animal-based diet. I think maybe 6+ months after that, I got it back, and it had been regular for the first time in my entire life. And so I think that was huge for preparing my body. Pregnancy takes a lot of energy, it takes a lot of nutrients and nourishment, and so it's really important to prepare your body for that beforehand and continue to do that while pregnant. And then of course healing my nervous system and making sure that my mind was in a good place for pregnancy as well, because I do believe that is just as important as nutrition. Are you concerned that the lack of sleep and stress will bring back symptoms? I'm not, because I consider myself to be healthy now. I don't think that my body would handle this in any different way than it would any normal healthy person, and I actually think that because I am so much more resourced now in terms of how to regulate my nervous system and take care of my body, that things are going to be okay. That doesn't mean it's going to be easy. I'm sure it will be really challenging, and I'll have to be careful to take care of myself well. I've definitely given thought to how much my life is going to change, and I'm just trying to stay excited for that overall. Have you had any testing done to see where your minerals are at, or are you just trusting how you feel? So I actually had a hair mineral analysis test during my first trimester, and this is something that I've just been kind of curious about for a long time. Truthfully, I'm not really sure how I even feel about this type of testing or if it's that beneficial, but I just thought it'd be interesting to see. So I did a test with upgraded formulas, and then I had a consult, and they recommended some mineral supplements based on the results that I had. So I've been taking magnesium, I've been taking potassium and calcium, and their supplements are supposed to be more absorbable. I guess they're nano minerals. This is something that one of my friends, Sarah, who has a podcast, I think it's called Sarah Kleiner Wellness, she used them. I just decided to try it as well. Do I think that's necessary for everybody to do? No, I don't, but I do think it is common to have mineral deficiencies, and that making sure to get enough of these trace minerals can really help with things like pregnancy, sickness, and nausea. That's just my 2 cents on that. Next question, what has pregnancy after loss been like? So for those of you guys that don't know, my first pregnancy ended in a miscarriage. This was just a couple of months before my current pregnancy now. I have a full video on this on my other channel as well. That was one of the hardest things that I've been through, but I actually felt like I was able to come out of it much quicker than I thought I would, because of all of I've learned about how to support the nervous system. It was interesting because so many people told me how difficult pregnancy would be after loss, and how it can kind of make you feel like you're robbed of that first pregnancy joy. And truthfully, I didn't feel that way. Overall, I've had a really good pregnancy. I've been able to step into that trust for my body to be able to do this. I had my moments, I'd say, very early on in my first trimester where I might have been a little worried it would happen again or concerned, but I did my best to not get too caught up in that and to just let myself be excited, to let myself be happy and joyful, because even if something did happen, I wanted to feel the joy for this baby. And the next question is tips for pregnancy after loss. I would just say to be gentle with yourself, to make sure you're nourishing your body. Even things like mantras can be really helpful. I had some that I wrote down and I'd say them out loud, if I was feeling a little nervous, or do some sort of pregnancy related meditation, and that was helpful in the beginning. Just keep doing your normal life things and try not to get too caught up in the fear and the worry, because that can very easily take your joy away. And it's absolutely possible to have a joyful pregnancy after loss. It can potentially mean more after going through something difficult like that, and it can be just as, if not more, joyful and beautiful. Next question, did you ever deal with infertility? No, we did not. So with my first pregnancy, we got pregnant the first month that we stopped not trying to get pregnant. And then obviously that ended in miscarriage, like I just mentioned. And then right after I healed from the miscarriage, about 2 or 3 months later, I was pregnant again with this current pregnancy now. And so I haven't ever experienced infertility, though I do wonder if I would have experienced it had we tried to have kids years ago, or even before I got sick, because I really didn't have a cycle. I almost completely lost it. And so I think a lot of what I've been doing to heal my body has probably been reclaiming my fertility as well, which I'm really grateful for. Are you planning to take your placenta and have it encapsulated? That I am so not sure of. Would love to hear your experiences with that in the comments. I feel like this is one of those topics where people are either very passionately like, do it, it's the best thing ever, or don't do it, it's terrible. So I don't know, we'll see. Thoughts on ultrasounds. I do follow Weston A. Price, and I know that they recommend avoiding ultrasounds. I have many friends that have decided not to have any ultrasounds, and I think that's great, but I also think that everybody has to kind of do what's best for them. And I love the idea of a wild pregnancy and not having monitoring and scanning and all those things, but after having a loss, I think it was helpful for me. I had one ultrasound at 9 weeks, and then I had my 20-week anatomy scan. That's all I plan on doing. It's hard to know. Some people think it's really, really harmful and really dangerous for the baby. I'm personally more on the side of like, maybe it's a bit stressful on the baby. Maybe it's not the best to have a lot of them frequently, but I think that sometimes it can be the best choice for people if they need that peace of mind. I actually would love to do a pregnancy without an ultrasound in the future, but for this one, we decided to do those two. Thoughts on hypnobirthing. So I actually just read a book on hypnobirthing that I really liked. What was interesting about it is that it really didn't talk about hypnosis at all. Really, the only idea of the book was that hypnobirthing is embracing birth without fear and having a safe and calm environment, and that it's possible to give birth without serious pain or serious discomfort, and that birth can be a joyful and exciting and positive experience. And so I loved that. There was nothing woo-woo about that book at all. I'm not sure if other hypnobirthing techniques involve some sort of complicated hypnosis. This book that I read had nothing along those lines. It all just seemed kind of scientific, and how important it is to feel safe during labor and delivery. So I think that's great. What kind of exercise are you doing, if any? So I go on walks every day. I usually go on a walk after breakfast, sometimes go for a second walk after dinner, and I have been rock climbing 3 times a week. So we have continued to do that in my pregnancy, and I just use the harness and the top rope, so when you fall, you just stay right where you are. Climbing regularly has helped me to continue to feel really great. It's something my body has been used to for a while now. I plan to continue that as long as possible. I'm still able to use my normal harness because I'm carrying on the smaller side, but I do have a over-the-shoulder full-body harness for when my bump gets too in the way. I've also been doing Pilates several times a week, and I just do free videos on YouTube from home, and I love that. My favorite pregnancy Pilates YouTuber is Jessica. Her channel is called Pregnancy and Postpartum TV. I will link that down below if I remember. And she just has hundreds of free workouts, and she's so positive about birth, and it's just helped me to feel really good. It actually helped me when I was having mild nausea in my first trimester, and just helps me to continue feeling strong and energized, and it feels like something I can do to prepare for labor and birth. What's your favorite part of being pregnant? I think it's just such a miracle to be able to go from barely surviving myself to now creating new life, and just seeing how empowering it is to be pregnant. It's just such a joy and such a blessing. I've loved being pregnant. It's been great. Will you take the glucose tolerance test? I declined the glucose tolerance test, but I actually got a glucose monitor instead. I will probably do a separate video on this, but my midwife offered a couple of different options. She offered the glucola drink, which is high fructose corn syrup and a lot of chemicals and stuff that I did not feel comfortable drinking. She also offered a grape juice alternative, which I kind of would have been fine doing, but I also feel like it's just not natural for me to wake up and have a bunch of sugar on its own, and so I didn't feel like that would be an accurate representation of what my blood sugar was doing. So she let me just wear this monitor for 2 weeks, and everything has been great and in range. Next pregnancy, I probably will just decline it altogether because it's not something that I'm worried about. And I think what's important with these things is to remember everything is a choice when it comes to pregnancy and birth. Any sort of treatment or testing or intervention is always your choice. They can't force you into doing anything, and you know your body best. This doesn't mean that a provider can't be helpful or give meaningful advice, but ultimately we are the ones that get to choose what's best for our bodies, and it's okay to say no if it doesn't feel right. And that's something I've learned in my healing journey, and that feels empowering. Anyways, I think that's about it for the questions. Like I said, I will timestamp all of them so you can skip through to which ones you want to listen to if you'd like, and make sure to subscribe and follow along on Instagram. I will look forward to seeing you guys in another video very soon.